It always starts with an idea. Mosaics are like a patchwork quilt. You take a bunch of small pieces and piece them together in a way that they create a bigger picture. There's a thought and process to starting my art. It's definitely important to have a plan to know where you're going to go. Each piece that I use is unique, and they all have different shapes, and they all fit together to work as a team, so to speak. The unique aspect of all these pieces is what makes them also important. As a group, they all become like this beautiful piece of art. I run into challenges along the way, and I enjoy finding creative solutions. It takes a lot of patience. I definitely get excited when I start seeing it come together. I never lose sight of the fact that everything needs to work together. It's not until you step back that you finally see the big picture.
Great. Thank you all for being here. Thank all of you for taking time out of your busy days across our system. I appreciate the flexibility with regards to the ILT and manager meetings. But we've got a lot of important things going on, and we thought it was key that we continue a dialogue with you. I know that COVID-19 is top of mind for many, if not most of you, and we will talk about that in great detail. We also wanted to make sure that we take the opportunity to discuss other issues that are going on in the health system as well. We really want to talk about and think about your role as leaders across Intermountain, and how you show up, how you make decisions, how you inspire confidence. Today we'll get a brief update on how the medical group and affiliates are contributing to our COVID-19 efforts. We'll talk briefly about the operational responses that we're seeing across the enterprise. And we'll talk from a caregiver experience standpoint, a leadership standpoint. Again, what are the behavioral expectations? What are the opportunities for all of us to shine, and also to learn things that will be valuable once this crisis is passed? Thank you for coming together as both an organization and as a team of leaders. Now, we're going to move quite quickly through the agenda because we think that an open question and answer period is going to be most important. My ask for all of you as leaders is to please ask the strategic questions, the things that you really need to know in order to lead effectively through this time. If there are highly specific questions, deal with that through the usual mechanisms, your HR partners, your leader, and if that doesn't work, then please escalate. If you have questions, when you have questions, please email them to covid19@imail.org. And even if we do not get to all of your questions, each will be answered. Every loop will be closed because your opinions count, your questions count. We want to make sure that you're very much on board. We will talk about our leadership responsibilities. This is a great opportunity for us to engage in dialogue throughout the organization and build trust and gain operational effectiveness, as well as prepare ourselves for a changing future. Our opportunity is to inspire confidence, both within the organization and in the community as a whole. We are being watched in the best possible ways. Each and every one of you is viewed as an Intermountain leader here, but also at home, at church, at soccer games, elsewhere. and I think it's very important for you to remember that people are watching. You need to know that we are prepared. You're going to hear that from the team. The work we've done around One Intermountain, the pandemic preparedness we've done over years, we are in the right place at the right time with the right team, and we are going to be successful in taking good care of each other and good care of our communities. The questions and prep that I've seen make me confident in our strategy, but more importantly, in our people. So I'd like to talk a little bit about how we need everyone's leadership. So we often think about leaders in a time like this as doctors and nurses, and they are very much leaders. But I did want to talk about Mark Olson, who's the facility manager at Intermountain Medical Center. Mark and his team were absolutely responsible for standing up the emergency preparedness unit. But what's really interesting is now they're thinking in very innovative and creative ways about how do we actually make sure that we increase the number of negative pressure rooms as needed? How do we expand capacity? How do we deal with airborne transmission? They haven't waited to be asked. They are leaning in. They're leaning in hard. They're using their intellect, their creativity, and their sense of responsibility to solve problems. And they're doing it in a coordinated and collaborative fashion. All of us need to do that. I want you to remember it's a privilege to lead. People are trusting you with their lives. Your fellow caregivers, your patients, your neighbors. What an honor for all of us, and we are well prepared. The disease that we're fighting kind of doesn't care. It's doing exactly what it's supposed to do. It's very effective, but we care. And caring is our greatest strength. We care for each other, we care for the patients, we care for the communities, and I think as long as we pivot back to that mission, we're going to be wildly successful, even as we face bumps in the road, at dealing with this opportunity. So please continue serving, recognize that it's a privilege, and take good care of each other. I'd like to introduce Mark Briesacker. He's our Chief Physician Executive, and he's going to provide you with a little bit of an update on what our medical group and our affiliate physicians are doing to help with this COVID-19 issue. Thank you, Mark.
Thanks. So over the past several weeks, I have had the opportunity to watch many of our committed, capable, passionate teams come together in our response to COVID-19. Now, Intermountain Healthcare is part of the communities we serve. In fact, you could say that we are in a really great position to have a true impact on the trajectory of COVID-19. Our reach across the Intermountain West is broad and deep, and we are where people live, where they work, and where they play. So we're there physically. Some examples. Sharon Sumner, infection prevention nurse at Intermountain Medical Center, Dr. Kristen Dascom, they were part of the teams and led the team that stood up our emergency preparedness unit at Intermountain Medical Center so that we could care for a fellow Utahn who had contracted COVID-19 while abroad. Our Intermountain Medical Group, led by Dr. Donna Barhorst and Rebecca Cooper-Knowles, our Healthcare Partners Nevada Medical Group, led by Mark Price and Dr. Amma Broby. They're caring for our patients every day in our clinics and hospitals. They're there in person. And we have other contributors, Dr. Mark Shaw of the Utah Emergency Physicians Group, who's been a long-standing partner with Mr. Craig Allen in helping us be prepared for emergencies such as this, any type of emergency. And it's from that preparation and those plans that we are pivoting and adjusting to in our response to COVID-19. Importantly, it's not just where we're there in person, we're also there virtually. So our outreach team, our infection prevention team, and our care management team weeks ago anticipated that we would be in this place. And they came together and are now using Health Answers and Connect Care to screen patients who potentially could have COVID-19 and determine if they need testing or not. And that's happening all through video. In addition to Connect Care, well, and let me just mention the leaders there that were involved. So Carrie Pelikanis, Dr. Kristen Dascom again, Dr. Todd Vento, Maria Hill, leading teams that made all this happen long before we were in this spot. Additionally, Dr. Bill Beninati and the whole telehealth team are serving our clinics, our hospitals, and partner hospitals across the Intermountain West. They're doing that with tele-infectious disease, telecritical care, telehospitalists, and many other specialties that we have in place. It's very clear to me that our teams are aware of the responsibility we have to keep our communities safe and informed, and at the same time, be preparing, be containing, and getting ready for that community spread of COVID-19 if and when that occurs. And I also know that we will step up and we will take this responsibility on going forward. So, to that end, here are some additional ways that we're preparing. We have been providing regular updates on clinical guidance on how to both recognize COVID-19, how to order testing, how to care for patients, how to care for caregivers who are providing that care. And those updates will continue to happen. I fully expect to see updates even today based on things we have learned from the CDC and the World Health Organization, as well as our partnership with the Utah Department of Health. We know that keeping people informed is really important, so we will be standing up a weekly call with physician and APP leaders, given the fact that this is evolving so quickly. Most importantly, it is our top priority that we keep our patients safe, we watch out for each other, and keep us safe. So please be looking for ongoing recommendations with respect to when and how to use personal protective equipment, how can we reuse it, and how to do that. So once again, I can't thank enough the teams, the leaders, our caregivers who have come together over these past couple of weeks to respond to COVID-19. Their professionalism, their commitment, you see it in every moment. We have the right people. We have the right clinical processes to keep our community safe, keep each other safe, and care for our patients. I am so thankful for their dedication and how they live our mission every day. So one team in particular that's been so important is our infection prevention team. These are 5 physicians, about 25 nurses, infection preventionists, who are led by Dr. Kristen Dascom and Sherry Frame, registered nurse. And it's my pleasure to hand things over to Dr. Eddie Senahem. You know Eddie from his work in antimicrobial stewardship. He's going to give us an update on COVID-19, where things are at today, and maybe what to expect going forward.
Great. Thanks, Mark. I've been asked to give an update on where things stand with COVID-19, both internationally, here in the U.S., and here locally. There's a slide that's going to be coming up that is a slide most of you have seen. This is a slide that shows the current epidemic as we know it in real-time data. All the red there represents cases of COVID-19. And we can get pretty pessimistic when we look at that because there's a lot of red there, and that red is growing every single day. But there's some glimmer of hope there. There's some good news there. The epidemic started in China, and it grew to approximately 80,000 cases. And it's exciting today to report that now in China, they have less than 20 new cases per day. Same thing in South Korea. They saw this epidemic rise. They've now got past that peak, and they see less than 10 new cases a day. So the epidemic center has shifted, and it's now shifted to Western Europe. So the countries of Italy, Germany, Spain, France are really the hotspots for this infection as it stands right now. Those countries are putting in pretty significant governmental controls and restrictions to control this virus. Now, when we move into the U.S., we see things really heating up. As of today, we have over 1,000 cases of COVID-19 in the U.S. right now. 4 days ago, we had approximately 400 cases. And so we're at the very beginning of this exponential rise of cases here in the U.S. In the U.S., the hotspots are Washington State, California, New York City, and particularly just north of New York City and New Rochelle. But that's changing every day. I suspect Chicago and Houston to be added to that list here shortly. Here in Utah, we have 2 cases. Both of those cases have been imported. meaning they came from travelers that most likely got infected elsewhere and brought it here to Utah. It's important for us to realize right now we have not seen any community transmission of COVID-19. But what should we expect? Should we be concerned? Life as we know it right now is going to change, and it's going to change temporarily. We will see more cases in Utah, and we likely will see them very shortly. We will see community transmission here in Utah, and we're going to have to adjust to that, and we're going to have to prepare for that like we've been doing for the past few months. This is going to mean that we're all going to have to contribute to this change. It's going to mean that we're going to have to limit our gathering in big crowds. It's going to mean that we're going to have to limit going to busy restaurants and movies and churches and soccer games. And we're going to have to do that to protect our community. Right now, it's really important for the people that are in those vulnerable classes, so age 60 and over and immunocompromised, to start doing that immediately. Okay, we want to start social distancing immediately for those really vulnerable ages, and then we will expand that to essentially all ages. And that is a moving target that we're continuing to monitor, and we're going to watch that on a daily basis. We'll keep you informed, like we said, in weekly updates and also guidance coming from us through email. So what can we do right now? It's really important, simple hand hygiene. I know it sounds pretty simple and easy, and it is, but we need to do it. This virus particle is transmitted on big respiratory droplets that land on things, lands on doorknobs, in bathrooms, wherever it might be, and us washing our hands gets rid of that virus. Okay, so simple hand hygiene, soap and water, etc. We also want to really emphasize if you're sick, don't come to work. Either work at home or don't come to work. It's really out of respect for our community. Same thing goes for your children. If your children are sick, don't send them to school. Okay, so these are all things that we can do to really slow this epidemic. We are not going to get out of not seeing this. It's going to come, and we need to be prepared to really minimize it so it has less of effect on our healthcare network. Okay? So I'll turn it over to Joe to tell us what we're doing for that.
I've got the opportunity to describe for you what we're doing across the system operationally to manage the situation. We start with a daily phone call, which has all of the ELT and about 150 leaders from across the system. That call is led on a rotating basis by Rob Allen, and Mark Breesacker, and Sue Roble. And that's a great coordinating phone call where we bring together the operations, supply chain, infectious disease and infection prevention, laboratory, our people, needs and plans, communications, information systems, analytics, and reports from a number of work groups. So very important coordinating work, which is helping a lot. And that's where you have seen a lot of the communications that have been coming out. Updates to policies, updates to communication processes, care standards, testing, etc. So a really great and effective group. We've also, more recently, stood up a management team within our clinical enterprise team, CET. Many of you know, have heard announcements about that recently commissioned. That's really just a collection of leaders from our specialty-based care, community-based care, children's health, clinical shared services, and clinical programs, where the leaders of those teams collectively meet, and we in that forum are now working on several operational plans. For instance, where should we be doing testing for patients? Right now we're sending them to a lot of our locations. We're pausing to ask, does it make more sense to concentrate that in fewer testing locations? We're looking at cohorting patients within our hospitals, within emergency departments, within nursing units. Should we be cohorting patients between hospitals? We have teams working on these questions. Should we be looking at drive-up assessment and sample collection systems? So we will have a lot of groups working on that. Need to certainly be connected to you in the facilities and clinics. Appreciate your surge plans, your emergency management plans you've had for years and are updating and leaning in. And we'll continue to work with you in executing these policies we need to put in place for this current situation. We have a lot of patients we care for every day that have nothing to do with COVID-19, right? So we ask you to continue to focus on providing appropriate, safe care. And our facilities are safe. And we need the community and our patients to know that. They shouldn't be canceling procedures or visits. They don't need to do that as we implement our appropriate safe protocols. We have restricted patient visitor for good reasons around increasing the safety, but patient care should continue. We're working on what we need to do to ramp up very quickly as Eddie talks about this expanding in a very rapid condition. We're already seeing quite a few patients that are coming into our clinics, our Instacares, and our hospitals. And the plans we're working on is what will we need to adjust if and when this moves up to a higher volume of these patients. One thing we'll ask, even as you lean in locally, making adaptations as appropriate, we welcome that and encourage that, but please also stay connected with system policies, procedures, and messages. We don't want to have different policies or different signage, so please help us stay consistent as we work with local needs in implementing these strategies. Let me turn to Suzanne Anderson, our nurse administrator from Intermountain Medical Center, who can share an experience we had just last weekend.
Thanks, Joe. I'm really excited to tell this story, so good afternoon. There's going to be a collage of individuals that comes up on your screen, and this is the story that happened about 8:30 Friday night. So as you can imagine, most of these people we've had a long week and we're ready to get, take it easy. These individuals all came together. At about 8:30, we were notified that a patient in our hospital had been exposed by a family member who was positive for COVID-19. So with that, we knew that he was high risk, over 60, just had open heart surgery. So we needed to focus both on that patient as well as the caregivers that potentially were also exposed to this visitor. So by 9 o'clock, we were all on a WebEx. I think by 9:30, there was the majority of these individuals at the hospital in our command center, working together. Just like that first story we saw in that collage of, mosaic tiles coming together to form a picture, that's what it took. The expertise of every single one of these individuals to ensure, first and foremost, we got the information to that patient to make sure he was aware of his risk and the concerns that we had for he and his family, and also ensure that we were isolating him immediately. The second thing is the caregivers. And not really second, it was in conjunction. The caregivers also that were exposed, ensuring that they had proper information. I had Dallin Hill, I'll shout out to, he's our employee health nurse at Intermountain Medical Center right by my side as we went up and visited with the 2 units where this patient had been on. And he was there, gave out his card to every caregiver and said, hey, call me. If you have a concern, if you're worried about your exposure or anything that occurred, please give me a call. So it was that kind of connection that it really took. And along with our communications team, as you see on the picture, there's quite a few that were there to try to help draft a message. Because once you tell 1 or 2 people, you've told a few in a hospital, correct? It goes, word spreads pretty quickly. So we knew we had to draft a communication that would not only go out to Intermountain Medical Center, but to the system, informing people of what the situation was, what we were doing, and how we were keeping the patient, our caregivers, and the community safe. So with that, it was an amazing orchestra, I alluded to, or that piece of artwork that occurred during that time. By 3 a.m. by midnight the patient was notified. By 1 a.m. all the caregivers on the 2 units had conversations. They were able to express their concerns. By 3 a.m. the full communication was drafted, ready to be sent, and by 7 a.m. that Saturday morning it went out to everybody at Intermountain Healthcare. So again, I think it just reflects on really, truly being there, delivering the messages. Not that an email for those caregivers would have been efficient or personal. We needed to be there. As a leader, I needed to be there to ensure that they had that information from me firsthand and that they could ask questions. So with that, I just again refer back to that beautiful piece of mosaic of teams coming together, working to solve very challenging problems and keeping our community safe and living our mission. Thank you. I'll turn some time over to Heather to talk more about people.
Okay, thanks, Suzanne. In order for us to execute on our caring mission that Mark talked about earlier, our caregivers are at the center of this, and keeping them healthy and safe is of utmost importance. One team that I want to recognize is our employee health team. This is a group of 42 caregivers in our system who have been on the front lines of keeping our caregivers safe. They have been ensuring that, coordinating with our educators to make sure that people have appropriate personal protective equipment, also known as PPE, that PPE works and they know how to use it. Our employee health nurses have fielded questions, particularly around travel, when we made our travel announcement last Friday. And they are monitoring supplies ongoing and daily are monitoring those caregivers who are either quarantined or in a furlough situation. So I love this team, 42 people taking care of 40,000 caregivers. It's pretty impressive. And as we think about our role as leaders to ensure we have safe environments and that we promote safety and flexibility so our caregivers can care for our patients, but most importantly care for themselves and their families as well, we each have a responsibility. We've been talking a lot over the last couple of years about a leader's responsibility to be effective communicators, understanding messages and pushing those through the system, to own the things that are going on and have accountability and responsibility for those things in your department. And we've seen a lot of great work in the system, teams coming together, working across the system to make things happen for our caregivers. As Eddie mentioned, it's really important that if you're sick, that you stay home. And as a leader, we each have to take care of ourselves first. If you use an airplane analogy, they always tell you to put your mask on first before you put other people's masks on. And that's what we hope you do as leaders. Using your teams to delegate appropriate work, because we have core work and we now have COVID work, and both of those things still have to get done. So prioritizing, balancing, and delegating. We also have a responsibility as leaders to help our caregivers take care of their families. Where flexibility can happen, that we allow people to work from home. And we know as this progresses, there's potential for school closures and for daycare closures, so being flexible there. As Suzanne mentioned, checking in ongoing with your caregivers, face-to-face as often as you can. How are they doing? What do they need? We've worked for 2 years in trying to really focus intentionally on caregiver safety, and this is where it comes alive. Making sure that our caregivers are wearing appropriate PPE in every situation, not just COVID-19 and respiratory issues. We have, as an HR team, with partnership with CET and our command center, been able to put some policies and changes in places to support our caregivers through this process. You'll see announcements coming out from our marketing and communication team about meetings. Just like this meeting today with our Intermountain leadership team, we reformatted. We held it virtually. We did not want to bring in additional risk with pulling 800 people together. So as leaders, look at your meetings that you're scheduling. We're recommending if meetings of more than 50, that you try to host those virtually, postpone or cancel those meetings. We're asking that all leaders do interviews virtually. We have technology in place that allows us to do that through HireVue or through WebEx. It works really well, and to limit exposure, we would ask that you start doing interviews virtually. Last Friday, we pushed out some new travel restrictions. They are connected to CDC restrictions, and we are asking that all non-essential business travel be canceled. We have not had any restrictions for personal travel, yet we are telling our caregivers to be very cautious and to make the right decisions, because as things change, it could affect your ability to come into work and may need to be quarantined. We have asked that our time and attendance policies be relaxed for COVID-related issues. Also, with working remotely, yesterday we had our first practice drill to work remotely and worked very well. And then we have put in place the ability to go negative PTO up to 80 hours for any COVID-related issues. There is a heightened sense of curiosity in situations like this, so please ensure that your caregivers are only accessing files that they need and not looking into records that they shouldn't. And then the last thing is we do have lots of media inquiries and folks who are posting online. Be very cautious about representing Intermountain. Connect with a marketing and communication individual for any social media inquiries or other media inquiries. We want one source of truth. In ending, there's lots of resources because we want you as leaders to make sure that you're informed and you understand the changes we're making. So Ask HR is a resource. Our COVID-19 webpage is a resource. Our Yammer COVID-19 social media channel is a resource. And then you can always email questions to covid19@imail.org. So I will turn the time back over to Mark.
Thanks, Heather.
Wrap up and have Q&A.
I don't think I need that, and I don't want to touch it. So let's start with a question from the folks who are physically present here. Anybody have a question? There we go.
I understand that they
Are you talking about legal immunity or physiologic immunity?
Well, I understand they're working on creating a vaccine. Probably won't be in time to, I don't know, deter the spread of the disease. But once you get the disease, are you immune to it? Do we know that?
Eddie, you want to go ahead and take that one?
Sure. We don't know. We can say right now nobody has immunity to this disease. It's a novel virus, and so we don't have any baseline immunity to it. Vaccine development's in the works, but realistically, we're months, if not years from that. So that's not going to help us here. In terms of will we develop long-lasting immunity, who knows? Will coronaviruses mutate very easily? Their DNA mutates very easily. That's why we can't develop immunity to the common cold virus, which is a type of coronavirus. So the question is we'll see, or the answer is we'll see, but doubtful. This virus is probably here for a while.
Great. Thank you. A question that we've gotten emailed in, it says, we're hearing different information between facilities. What resources can we rely on to provide accurate instructions on what to do if somebody comes in and has symptoms and appropriate use of PPE? Do you want to take that, Joe or Suzanne? Is that the right swim
So
lane?
we have our clinical guidelines that are sent out from our team and updated on a regular basis, and those are available on the website, but all caregivers should have those locally. Eddie or Mark, you can talk about the distribution to our caregivers.
Well, I think if you go to intermountain.net, it's right there at the top now. It used to be off to the side a little bit. It's moved up here, and it's really big. You click on that link, and it takes you to all these resources that are updated on an ongoing basis. So that is the source of truth around personal protective equipment.
And I would say that it's evolving, and it's rapidly changing. And so our processes are evolving and rapidly changing as well. Lab tests right now are going to the Utah Department of Health lab, but very shortly they're going to be going to our Intermountain Central lab. CDC just came out with new guidance on PPE, and so we're updating these documents almost daily, and so make sure we're using the website to get the most recent update.
Great.
And Mark, there was one piece about
Please,
what would you do if people come in with symptoms? Send them home. We actually need everybody to be accountable to be out of our facilities if you have symptoms, if you're sick.
Great, thank you. So a question came in from Brent Wigington, Supply Chain Operations Director at Supply Chain, and he asks, can we remind caregivers to keep supplies safe and out of the public eye so they don't get stolen or abused by the public? Brent, I have now reminded everybody, so it's a great point. And look, the vast majority of people are terrific and generous and honorable, but there are a couple of bad apples. We've had a couple of experiences across the system, and I think your reminder is an excellent one. So here's a question, and actually, Rob, I'll ask you to chime in on this one as well. And it says, how will we maintain business continuity as we continue responding to COVID-19? Rob?
Well, this is a great question, and it's important to remember that almost every patient we're taking care of today does not have COVID-19. And it's really important that our teams continue to do the work we do, that we do it well, that we continue to take care of people and fulfill our mission. One of the questions that comes in is, how do we determine when to shift our resource or our attention? And the right answer is do the right thing. And that's something we've always done at Intermountain Healthcare. So continue to do your work. There are teams working on the issues that relate to business continuity. How do we get people in for services? How do we get paid for the services that we provide? But first and foremost, let's take care of people, do the right thing, and we'll continue to work to make sure that everyone who needs our services can access them and gets what they need when they need it.
Thanks, Rob. The other thing that I'll say we heard earlier today is folks really expressing admiration for how quickly and definitively decisions are being made on a daily, sometimes even an hourly basis. I think that's amazing and fantastic, and I also would say let's not lose that. And that actually should be for everything we do all the time. And now I will tell you that my already high expectations have been raised in terms of nimbleness. So please, speed and accuracy and collegiality is always good for the people we serve. Okay, so here comes a question. This one's from Dave Dirks in the EIO. And he said, do we now have adequate testing capacity, or is that still coming online? So Eddie, I think that was probably you.
Yeah, that great question by David. As it stands right now today, the testing is done at the Utah State Lab. We have the capacity maybe doing 20 tests a day for the entire state of Utah. That's clearly not enough. Very soon, hopefully by Friday, we will have internal testing at our central lab. And once that transition happens, we'll have the ability to test approximately 300 tests per day, which is a great increase for us. It'll be really important, though, for us to make sure that we're still testing people that have symptoms of COVID-19. We want to make sure that we're using these tests appropriately. Even though we have more tests, we want to make sure we're using them appropriately. So stay tuned, likely Friday, latest next week.
That's fantastic. And I will encourage folks to please email in questions other than COVID-19. We really were very much looking forward to an ILT where we could answer all kinds of questions about what's going on in the system, and love to hear from you on other issues as well. That said, this is a great one. It's from Vanessa Waite, Practice Director at Dixie Regional Hospital. And she asks, how are we informing visitors and patients of the visitor restrictions before they get to our facilities? Can we do it through My Health?
Sure.
Over you and Suzanne?
Well, yeah, I don't know about My Health. We'll ask about that. It's a good idea.
It's a great idea.
Suzanne actually was on television the other night announcing these restrictions, so most of the state heard that.
Yeah.
But we can also be talking about our clinics, calling for appointments and reminders, and make sure that we have scripts in that. So what else, Suzanne?
Yes, and I think there's also, anytime there's appointment scheduling, et cetera, we've already leveraged our teams to say that, to know that they will be checked as they come into our facilities. Hand washing is key. We have the Avogard pumps right at the front doors as they come in. But I do think it is really news media that has already gotten this out. I mentioned, I think, to Joe last night that even the halls Viemed are not as jammed as they usually are. So it's starting to spread that word of, you know what, it's stay home unless you need to come to our facilities. It's safe to come for care, but let's be cognizant of the spread.
Great. So Haley Summerhays, a nurse practitioner at Riverton, asks, how can we be proactive in having virtual visits in our ambulatory clinics ready? Will we still be able to send patients to the lab for blood work, et cetera? Mark, do you want to go ahead and take that one?
Yes, so the teams really over the past year have been moving forward on virtual visits in our clinics. And this is really an opportunity for us to continue to think about how we can do this even more quickly and even better and do a lot of learning. I think a key message here also is, and this is for physicians and nurses, is we really ought to be thinking about who do we need to see in person and who should be cared for through a telehealth visit or through a telephone visit. And so our teams, our leaders met yesterday, and we spent a fair amount of time talking about this very thing, and that's the guidance that we're sending to them. So this is one of those opportunities for us to try some new ideas, get better at it, and then hang on to those ideas as the new way to care for people going forward.
And that's exactly what I was thinking as I was listening to you. I mean, this sounds a little trite. Some people say never waste a good crisis. And I think we're learning really valuable things about how to work together, but also how might our operations change for the future to make sure that things are as seamless, frictionless, inexpensive, high quality as possible for the people we serve, even after this has passed. So here's another question, and it is: does the current coronavirus situation change our goals for the year? And I'm going to try and take this one, and Rob or other folks can leap in if they think I'm missing, but the answer is no. Our goals are organized around safety, quality, patient experience, access, and stewardship, and they remain relevant. Now, we are not rigid people, and our board is certainly not rigid, and we will morph as the situation demands. But for now, stick to your knitting, do the projects you're supposed to be doing, make your numbers. Most importantly, take great care of each other and take great care of our patients, and then we'll stay fluid. If things need to change, we'll change them. But we're directionally correct around providing population health and value-based care, and that doesn't change. Did I do okay? All right, I got a nod. So, yes, there's a question here in the audience, please.
Thank you. Thank you. So we heard a lot about social distancing for,
Yes.
especially for folks over 60. Would that also apply to receiving any care in our facilities? We heard business as usual and you shouldn't be concerned to receive care, but does that also apply to everyone over 60? We're getting a lot of questions from our payer partners and love your thoughts on that.
So the answer is it's still very safe to see patients in our facilities. It's still safe to do elective surgeries. There is additional focus and additional questions as you do the pre-screening work that have been put into place, and those get updated on a regular basis as things evolve across the country and across the world. So the short answer is yes, it is still safe, and let's be proactive in making sure we're doing the right things at the right time.
It's a great question. If people need care, they should get it. And as a general principle, let's take care of them before their problems get really bad. And that, again, this is around let's just do the right thing. We can overthink things if we're not careful.
And I can just add, as patients come into our facilities, they're assessed. And if they are at risk, then that's what we're working on. How do we cohort and put these into safer places to not expose other patients?
So here's a question. Jeffrey Goff from Project Management at Lake Park asks, any restrictions on vendors visiting Intermountain clinical offices, non-clinical areas? I have no idea what the answer to that is. Who does?
We were asked this question yesterday in our administrator phone call, and we took that down and said, that's a good question. We've got to address that.
So Jeff, you get a gold star for asking a question that stumped the whole panel. And this is one of the ones where we will close the loop and make sure that you and everybody else has an answer to this excellent question. Thank you for pushing us. It's the wisdom of the group, as always, is great. So Jessica Shields is a clinical nutrition manager at LDS Hospital, and she asks, there's been a lot of talk in the media about the cost of COVID-19 testing and care, and that it may deter people from seeking intervention. How does Intermountain and Select Health plan to address that concern?
So Select Health determined this week that they will cover the costs of care that are related with COVID-19. So I think health insurance is different based on who you work for, and all those things still apply, but we're going to take great care of people.
Great.
And I can add to that.
Yes,
The
please.
question also came up yesterday. Sometimes when patients call in, they're sent to go get testing, and sometimes they'll show up at the emergency department of the hospital, We're assuring you are not going to get an emergency room charge for a lab specimen collection.
Right.
And I do think it's important to highlight that the vast majority of people that get coronavirus do completely fine. They go home, they've got cold and flu symptoms, they don't end up hospitalized. And so for the majority, and I can comfortably say majority, is that these people are home recovering. And it's the minority of patients that actually end up in the hospital in the ICU.
And that's really reassuring to understand. So here's a great one. Maylee Taylor, nurse manager at Utah Valley Hospital, asks, we're hearing the CDC is discussing changing to droplet precautions and not airborne. Can you speak to this? And if it is determined droplet, do we use airborne precautions during high-risk procedures? Maylee, I think you were watching CNN this morning. Because, I think that actually, unless I'm mistaken, Eddie, that's like hot off the press, right?
That recommendation came out immediately before our physician leadership meeting yesterday. CDC is saying that moving forward, droplet precautions along with contact isolation is appropriate PPE for the vast majority of patients. That said, in people that are undergoing aerosolizing procedures or even testing, that we still want to use N95 and PAPRs for those patients. We are currently updating our clinical guidance document today, and we will have an update reflecting some of those changes here very shortly.
Great. I'm going to take this as super good news because it should preserve our stock of N95 for folks who really need them, right?
Correct.
So let's take a couple questions from the folks here.
I appreciate the reminder that most of our patients are not COVID-19, but I'm wondering about, we're hearing about shortages of supplies, and I'm wondering how we as a system are doing with supplies and what we as leaders can do to ensure that we have adequate supplies.
So I'm going to try and take this, and again, at this point in time, we have everything we need, right? And what we're asking people to do is be extremely careful and use the right supply at the right time, and not too many of them, and not to throw away things that can be repurposed. But I think if we stick to that, we should be okay. Fair enough? And actually, a point that came up on the call this morning, I think it's really worthwhile, is that if there are expired supplies, do not throw them away, particularly the N95 masks. That supply chain is taking those and they're holding them in reserve. They're probably just fine and safe to use, and we'll use those to augment the other supplies that we have. Does that make sense? Okay, but people need not worry, and if they don't have something on their floor, they need to immediately escalate to their manager, and they should have what they need. Okay? Okay, another question from the audience?
Thank you. The World Health Organization just today declared a pandemic. Does that make any change on the ground in our day-to-day operations? What does that mean?
So no, the answer is no. WHO labeled that a pandemic as of this morning, worldwide spread of an infection. It doesn't change our plans. We have been planning and getting ready for this spread here in Utah and also in the US for months. And so at this point, it doesn't change our focus or our mission, and we're going to continue to take care of our community.
Okay. There's a really terrific question that I think we need to take that's been emailed in by David Edwards, medical informatics at the central office. And David asks, what is our load capacity for our resources in our ICUs, especially ventilators? Are we ready for a possible large surge in severely ill patients? And Suzanne and Joe, I know you guys are like living this moment to moment.
Right.
Do you guys want to talk about this, please?
I can start. I know that our respiratory care leaders in the system have identified all of our ventilator supply. So I think as far as the supply of ventilators, we're fine. We've got several different types. That's in line with our critical care operations lane. They're working together to identify that. And I think, as Dr. Stanaham says, is there going to be a large surge in severely ill patients? Most are not going to be severely ill. That being said, I think we are prepared. We've identified all ICU beds within the system that can care for these patients. And again, it's really ensuring that our caregivers know what they need to do when they are caring for the severely ill, because most of those procedures that are done are aerosolizing.
Great. So I'm going to pivot for just, oh, I'm sorry. Did you wish to comment? Okay.
I just add briefly to
Yes,
that.
please,
We
Joe.
do have our critical care operating lane led by Dr. Grissom and Troy Creer, Mark Evans. They are looking at all of our ICUs across the system, cohorting, surging, and planning on all that. So this is all being addressed in real time.
Great, and I really appreciate the level of sophistication of these questions. I mean, they are fantastic. There's a really good one that, Heather, I think you should probably take, and it's from Mike Busdicker, Clinical Engineering Director at Supply Chain. And Mike asks, if we have caregivers traveling out of state on vacation to places like California, do they need to check in with employee health before returning to work?
Very good question. First and foremost, I would say check in with your leader to let them know that you're going to be out of town. And then when you return, I think it's a really good idea to check in with employee health, because as we've talked about today, this is ever evolving and there are potentials for CDC changes that you may have to be quarantined. So
great. I'm going to pivot for just a second, and I'm going to say how thrilled I am that we have Healthcare Partners Nevada as part of our team. They are so perfectly aligned with the rest of the organization in terms of their commitment to population health and value. And we're learning a lot from them, and I think that they're benefiting from the wisdom of the larger team, particularly around the COVID-19 preparedness. They're terrific. One of the questions that I'm regularly asked, and people seem confused, is growth sort of a zero-sum game? If a dollar goes towards growth, does it mean that that dollar doesn't go elsewhere in the system? And does it lead to shortages? Too much resources in one place, not enough in another. And that particularly comes up around our sponsorship of the Raiders practice facility. And I was wondering if maybe Dan would go ahead and talk about that, because I'd like to deconflict this sort of once and for all.
Yeah, you bet. Thanks, Mark. So we were absolutely delighted to have Healthcare Partners join the Intermountain family. Our strategy is really to grow the number of people we care for. And we want to take full clinical and financial accountability for populations of people over periods of time. And that's exactly what Healthcare Partners does. They're one of the best medical groups in the business at doing this, and we're just delighted to have them as part of our team. As we entered Las Vegas, we actually have to change the name of Healthcare Partners. It's a name we cannot use, and we will be establishing the Intermountain brand in that market. They don't know us down there. And as you know, if you've driven down I-15 on the Vegas Strip, it is really hard to get people's attention in appropriate ways in Las Vegas. And the Raiders approached us and said, look, we're new to the market. You're new to this market. They are deeply concerned about issues like social determinants of health, domestic violence, other things that community struggles with in many ways we don't struggle as much here as they do down there, and asked us if we would partner with them in new ways. And we thought, that makes sense. How do you signal to a community that we're there and we're committed to the community? And that we thought it was a great partnership. So we sponsored the practice facility. We'll also be providing clinic services at events at the stadium there. But most importantly, look to partner with them to really address the underlying health needs in that community. And we're delighted so far with their responsiveness and willingness to work together.
Thanks. And it was either the practice facility or a dispensary. And we thought that probably thought the practice facility was the way to go. Okay, another question from the audience here. Please, Marissa.
One question I have, this is such a natural experiment for some of those strategic lessons learned that have been referenced, whether it's what it means to not go to as many conferences or to be more resourceful with elements that we could reuse, or the fact that yesterday's air quality here in downtown Salt Lake City was amazing for those of us who commute by bike.
Isn't that interesting?
And so I'm just wondering, is there a way, I know personally that sometimes things move quickly in the aftermath of crisis or in the midst of crisis, so how can we help with documenting and archiving these lessons learned in real time so that we can learn from this natural experiment?
Well, we are doing through the COVID-19 call. I know that we are, as a good project management organization, we are getting those lessons learned. But I think some of these ancillary lessons learned are not being captured. And I think we will probably take that as a terrific observation and something that we should do. So thank you. And again, in the interest of not wasting a good crisis, I mean, how terrific if we start to embed telecommuting in a large way. That could have an enormous impact on air quality. So thank you. Did I miss anything?
The health answers question's already been answered.
Yeah.
My health, they've already fixed it.
Oh, is that right?
So that's what they have on the screen.
Okay, so it says update for the panel. Question about informing people about visitor restrictions through My Health. Yes, we will be emailing visitor information and other COVID-19 information to all My Health users later today.
Power of an idea.
Man, that's awesome.
But also on the idea of capturing, documenting, love it. Yeah, we need to do that.
Terrific, thank you.
I think one thing to say on that is we have submitted a system-wide IRB to study our response to the COVID infection, and so that has gone through the Office of Research, and thanks to the critical care line with Ethan Pelton and Colin Grissom and the ID team. But I think you bring up some great ideas from a research standpoint, and how do we partner with our Office of Research to ensure that we're tracking these things and we have the right inputs to be able to do that long term.
So I think let's wrap things up. I hope that all of you as leaders have a sense for the extraordinary talents we have within our organization. And these aren't just individual talents, it's the power of the team. And I've never seen anything like the level of collaboration and collegiality, humility to listen to other people's ideas, strength in expressing alternative opinions, and an ability to get things done. If you've only worked at Intermountain, or you've worked here a really long time, you don't know how unbelievably lucky we are. I guarantee you there is no integrated system in the United States that is as well prepared as we are. And I think Eddie's right. We're going to see some things happen. But I actually think that we're going to be able to mitigate the severity of those events thanks to all of your talents and your attention. And I think this will be something, in the end, that we look back on with great pride as an opportunity for all of us to have come together, connected with mission and connected with each other in really a very profound and powerful way. So with that said, thank you so much. Please expect regular communications and opportunities to have dialogue with us. And please keep sharing your ideas, because clearly we need all of your intellect and talents in order to serve as effectively as possible. Thank you so much and have a great day.